Hi everyone, thanks for joining our webinar today on enTouch for skilled nursing facilities. My name is Iqbal Barach and I head up marketing for Prepared Health. I'm joined by Travis Woyner, Director of Outcomes at Prepared Health. We expect the webinar to last no more than 30 minutes and we'll leave plenty of time for questions. We will be covering an overview of enTouch and how it helps SNFs enhance referral management, optimize patient workflows, and ultimately reduces readmissions. Travis will provide a demo of the platform, and we will end with steps on how to enroll your organization onto enTouch. Before we begin, I wanted to quickly highlight our mission at Prepared Health. Prepared Health was founded in Chicago about 3 years ago with the mission to help deliver a coordinated and complete picture of patient care outside of the hospital. To this end, we've developed the enTouch network for any and all post-acute providers, including SNFs, hospital discharge units, home health agencies, etc. Basically anyone who might interact with a patient on their journey from hospital to home. The network is free to join and set up your profile. Moreover, enTouch allows each provider to invite their list of trusted partners right from within the application. We tried to make this as easy as LinkedIn so you can quickly begin to grow your network. We've had considerable success in our early markets, Pennsylvania, Illinois, and Florida, and now the network is available to any post-acute providers nationally to join and get started. At Prepared Health, we have two main product lines, enTouch, which we are discussing today, and Dina, our digital nursing assistant, that helps improve patient outcomes through evidence-based interventions by analyzing an organization's patient data. Dina is an enterprise solution which many of our larger partners are leveraging. We will cover Dina in a subsequent webinar, but if you are interested in learning more about Dina, please don't hesitate to reach out to us. Some of the benefits of enTouch include the ability to highlight home health agencies and SNFs that deliver superior service, ensure successful transitions across the care continuum, and to facilitate HIPAA-compliant communication between post-acute providers to ensure the best possible outcomes. To really understand how enTouch works, it's best to walk through sample scenarios right within the platform. With that, I'm going to turn it over to Travis, who will walk through an enTouch demo.
Good morning, everybody. Excited to be here with you today. Excited about the opportunity to talk through some of the challenges currently facing skilled nursing facilities. And then from there, jumping into some of the ways we here at Prepared Health are providing the tools to tackle those challenges. As Iqbal mentioned, we would love to hear your questions and feedback along the way. So be sure to throw anything into the comments box and we'll try to get to those at the end. If we aren't able to see them or get to them before we wrap up here, we will follow up with you personally. That said, I want to first highlight a few key issues that we found fairly systemic while working with our skilled nursing partners so far, so that we keep those in mind while we hop into enTouch. First, managing the volume and disparate modes of communication taking place around referrals is difficult and becoming more so. Admission and discharge teams are responsible for monitoring texts, calls, emails, faxes, personal drop-ins. It's a lot. Staff are consistently expected to become more responsive and have better turnaround while the complexity continues to increase at the same time. It's a difficult situation and one we focus deeply on improving. The goal here is to have an efficient, easy-to-use system that a new team member can pick up quickly and operate in right off the bat. As turnover continues to become an issue in healthcare, that last piece is particularly important. The second item, narrowing the network of downstream partners to focus on what the patient needs and where the patient is. Many of our skilled nursing partners have discharge teams that work through a static list of preferred partners. And they work off of that to find a potential match for their patient and go from there. Some of them also utilize the shotgun referral approach of sending, for example, a home health discharge to a variety of downstream partners, with the first one to respond becoming the first one to receive the referral. In reality, best case scenario from our perspective, is having a tailored list of preferred partners presented to you based on what the patient needs, what the patient can have, i.e. their insurance, focused on where the patient is, all while reviewing the quality of these partner providers to make the absolute best decision. The key here is finding the right sources of that data and looking for a way to map it that is actionable for you and your staff. And lastly, SNFs are more and more engaged in producing quality outcomes with less resources, whether participating in bundled programs or simply having some sort of quality commitment with hospitals and health systems to show successful patient results. Skilled nursing facilities are being put under increasing pressure with continually higher stakes. In order to be successful in this, skilled nursing facilities need visibility into their downstream partners. Care conferences are well utilized in this space, and some groups have found success interfacing certain data points into new places to help provide some of that visibility. We believe the answer is more simple than that. You need the ability to communicate holistically with your partners, and from there, you need a way to monitor your downstream partners and your network as well. Ultimately, reporting all of this back to the hospitals, to the health systems, the quality of your facility, of the care you provide, as well as that of your preferred partner network. So with that, I'm going to hop into enTouch. See the screen change here momentarily. So you should all be presented with a view of enTouch now. And to frame this demo a bit, I'm going to start with navigating the inbox, which we're currently on for managing referrals. We're going to send a referral to a downstream partner. We're going to jump into a patient rally, for managing risk associated with my patient. Then show the network page and how to invite a partner. From there, I'll show you an example dashboard designed to manage those downstream partners and report out that success and efficacy of your organization. So here we go. As I log in, I'm brought to my inbox. I'm in as Chris from the skilled nursing facility. Inbox is my one-stop shop for referral management. You know, one of our primary competitors is the fax machine. Being a technology person, it's a difficult pill for me to swallow. So I'm really happy and excited about what we're able to do right here within the inbox. So here we have access to all my inbound and outbound referrals. My referrals, as we see, are segmented into 4 folders. First, I have my action required, which is currently highlighted. Action required is anything that is yet to be completed. I see here that I have a referral from my partners at Intera Hospital. Let's go ahead and open that up and check out an inbound referral. Within the referral, we see a few things. We see the basic demographics of our patient. We see the sender and recipient. And we see a timeline associated with this referral as well. Let's look at the notes to figure out a little bit more detail associated with this timeline. So originally, the case manager at Intera Hospital sends over the referral with the referral packet attached. I then indicate that this referral is being evaluated, making sure it's a good fit for my organization. That indication that this referral is being evaluated is communicated back to case manager at Intera Hospital. This is really going to start streamlining that conversation and opening up dialogue to ensure that we're referring and sending patients to the right provider at the right time. From there, I can drop in a quick note asking for primary family contact, at which point Casey responds with the phone number for the son. I've also indicated that we're going to put this on hold for a moment for the client having a temporary change in condition. Now, historically, you may have to decline a referral or you may lose your referral in kind of the chaos of managing everything else that's going on if a discharge is extended for a week, 2 weeks, or a month. In this case, by putting this on hold, I'm able to indicate to my upstream partner, the hospital, that we intend to take this patient on service. It's a good fit for our organization. And when they're ready to be discharged from the hospital, we will go ahead and move forward with this transition. So you can see soon after that, I once again indicated that this was being evaluated. From that point, I want to call your attention to one thing in the bottom corner here is the file attachment. So Casey manager from the hospital had included a referral packet. This referral packet will travel with this referral within enTouch in perpetuity. We'll always have access to go back and review this document, making this a fantastic depot for managing those inbound and outbound referrals. Once I'm ready to move forward, I can decline, I can indicate that this needs to be put on hold again, or I can accept. I'm going to go ahead and jump back to the inbox and look at the rest of the folders and look at how these statuses change. So again, we have our action required referral we just looked at. We also have our pending review folder. In pending review, we see all of our outbound referrals, particularly important for our skilled nursing facilities. We can see that I've recently sent an outbound referral for Mr. Tibia here. I'm going to go ahead and open that up just to highlight a couple things. One, this is the same view that you just saw the inbound referral. So what's great is that as you're having this conversation via notes back and forth, you know both the sender and the recipient of that referral is seeing the same thing. You can have a great conversation and you can really work through and achieve getting that patient to the right care setting at the right time. So continuing on the folders, we also have our hold folder, which we discussed. Then we have our completed folder as well. So you can see our different statuses associated with these patients. I'm going to open up this first one here. And this was a completed referral for our patient, Annette Atrium. You can see it was sent under evaluation, and then it was accepted. This is a great process. We were able to add notes. We were able to have a referral packet and note that it's still available in the completed folder for us to review and reference later on. So jumping all the way back to my action required, I just want to recap these folders for 1 second. We have our action required, anything inbound that is not yet completed, our pending review, anything outbound that is not yet completed, our hold folder for any patients that have had a change in condition, or we simply need to put this patient on hold prior to bringing them on service while communicating that back to the referral sender, and then our completed folder, which has anything that we've accepted or declined in perpetuity available for reference going forward. So with that, I want to go ahead and send a referral so we can see what that process looks like as well. So I'm going to select new referral. I'm going to toss in a patient that I have an existing relationship with, Becky Backbone, who has CHF. I'm now brought to this screen here. We can see that there is an indicator of exactly where Becky Backbone is. So when we look at tailoring a list associated with the patient and making sure that they're getting the right provider at the right time, we can now target our list, which in the past was most likely a static spreadsheet. We can target our live list around where this patient is and ensure that we're getting them the right service at the right time. So I know Becky needs home health services. I know Tinley Park has a service area associated with Becky here in Chicago. I'm going to indicate home health. I can do a quick look at insurance is accepted. Becky's being discharged later this week, so I'm going to request to start up care on Friday. Drop in some quick notes here for Becky. And then indicate that Becky does have support at home. Additionally, as we saw on the receiving end, attachments being sent, I'm going to go ahead and pop on a quick insurance card here. So we can see that will now travel with this referral as well. So when I click continue, I'm brought to a recap screen to look at a few things. Full view of the referral. If we needed to, we could add additional providers and send this in kind of one blast downstream. So if we need to add a DME or a meal service, we could do that as well for private duty. In this case, we're all set with home health, so I'm going to click send now. We can see that that referral was successfully sent. And then when we jump back to the pending review, it's at the top of our list. So the inbox, again, your one-stop shop for managing those referrals, both inbound and outbound, gives you a great opportunity to engage in a conversation while that referral is being processed and ensure that your referral recipients are able to take that patient on, are ready to provide excellent service, that those conversations are happening holistically, and that they're referenceable in the past once they land in the completed folder. Perfect. So continuing on, I like to think of the referral as kind of the initiation of a conversation associated with some of our patients. So it's basically saying to my partner, I have a patient and this patient needs care. When we move to the Rally tab, through the top of the enTouch platform, we're brought to a list of patients that are segmented by risk. And this is where I view kind of the continuation of that conversation. So I'm going to open Nora Knee here. And when I'm brought into Nora Knee's rally, we can see a few things. First, we see our basic demographics. Next, we see our active team currently providing care. We see an opportunity to schedule activities. And we see a quick snapshot of the history of this care that was provided. Now I'm going to scroll down and show you kind of the feed view of what this looks like. But again, I just wanted to revisit that comment. So the sending and receiving of a referral is the initiation of the care around Nora Knee. Once Nora Knee is brought on service, and I'm looking for a way to holistically communicate with my partners and manage the risk associated with my patient, Ms. Knee, I will go ahead and initiate a patient rally, and I will add my partners, both internally, in this case, Corey and Dr. Arthur are both staffers at Happy Home Health, but then externally, when we look at Casey Manager and me, Chris Coordinator. So we start to build out this team and give them an opportunity to communicate in one central location and really manage the care associated with this patient. Now, we're not replacing existing legacy EHRs and EMRs. This is an opportunity to communicate on what's happening, provide those updates, and make sure that we're all on the same page moving through the care associated with Ms. Knee here. So I've scrolled to the bottom to kind of walk you through what this looked like. So Casey Manager initiated this rally. So this is most likely a case where Nora Knee is in their bundled program. They want to make sure that we're tracking this TJR from the point of discharge for the next 90 days. So Casey initiates this rally, provides some initial context on what's happening with the patient, has monitored an activity, and then starts to add in additional information. So a fantastic opportunity here is the ability to share attachments and ultimately share pictures as well. So when we're working through a TJR program, we can start monitoring and actively sharing an image of what's going on with the wound from the point of care. So moving forward, Dr. Dujoint, the specialist, is engaged. We then have Intera Hospital, skilled nursing, an additional picture, and we start to see the progression into the home health arena. So we started from the hospital, we had engagement from specialist physicians, we had engagement from our case manager, we had engagement from our skilled nursing staff, and from there, we were able to transition them into the home health provider and make sure that they continue to receive that accurate and appropriate care while all of our providers have the ability to see what's going on with this patient. So this is a really, really nice opportunity to manage that risk and help drive that communication around what's going on with your patients. So we have a number of large skilled nursing centers actively using this today, whereas over here we see your Intera Hospital, your Happy Home Health, and your skilled nursing. For them, it's their internal service lines that they've managed to connect via the rally, and then their additional external partners. So they start with their social workers, make sure that they're able to communicate and drive the discharge management, and then ultimately the care that's provided to their patients upon discharge through their physician services, through their visiting rehab services, and then their transition kind of oversight group that makes sure everything's moving very well. When they're ready, they add their external partners from home health, from private duty, and some community-based resources to build out the perfect rally and make sure everybody has the opportunity to engage. When you add in a new provider, they're given visibility into everything that has happened with this patient to date. So it's a fantastic way to bring somebody up to speed with the care that's been provided, the communications that have happened to date in a very efficient, quick way. So that said, that's the patient rally. I want to highlight one more feature within enTouch before we highlight the dashboard itself. I want to jump to the network tab. And this is in Philadelphia. I'm just showing you some example organizations that are on the network and what this looks like. But the network tab is an opportunity for you to view who's around you, who's listed on enTouch, who's already engaged and active. One thing to note, if you need to ever invite a partner, you have this ability. We really want to empower you to build and manage your own network on the enTouch platform. So for example, say somebody comes in for a drop-in. We're talking about, I have a couple discharges later this week. It would be great to leverage enTouch to pass the discharges to you because we're using it for 80% of our discharges to date, and you're responsible for our remaining 20. This person says, fantastic, let's bring them into my home health facility. How do I get up on enTouch? I can go ahead and invite that partner right from the get-go. I drop in their organization name, some initial details, their email, number, and a personal note. This is an opportunity, I like to think, to drive some of that engagement, give a nice hook into the conversation and remind them why you're coming up on enTouch. From there, you simply invite the partner. It's that quick and easy to get them over and on the network. I like to say, maximum it takes an hour, and that's like if it takes you 58 minutes to check your email. So very quick and easy, under 5 minutes, and all of a sudden you're exchanging and receiving referrals via enTouch. So with that, that's the system. We've gone through the inbox for managing our inbound and outbound referrals, looking at a really quick and easy way to kind of review our sent and completed referrals. People can step right onto this platform and use it almost immediately. Then there's rallies for continuing the conversation around that care and looking into risk management. There's the network for understanding who is around us and who's actively engaged on enTouch and inviting partners from that point. So the next step here is really, what does this look like from kind of a review perspective, and how do we start reporting this out from a data management? So moving a little further, I wanted to show you an example dashboard of what we put together for some of our skilled nursing centers. I'm going to orient you to this as there is a bunch of colors and a lot of numbers, which is a good thing. Data is fantastic. Across the top, we can see our referral volumes. If we have a specialty referral line, we want to definitely call that out, and we want to advertise that to our upstream partners. If we're great at managing CHF patients, let's ensure that we're advertising that, and that is very clear to our referral sources. The number of patient rallies created this month, which ultimately feeds into our monetary value associated with managed readmission risk. So we want to look at how many high-risk patients do we actively have on service, are we managing via rallies, and what is that financial threshold associated. So this top line right here is already a very valuable conversation to hand over to referral sources and potential partners within hospitals and health systems and say, look at what I'm able to do. From there, we want to take it a step further and start showing what does our referral mix look like. So our outgoing referrals by service line and by partner. So for my skilled nursing center, I'm sending referrals onto primarily home health, but there is some additional mix in there as well. So what does that look like, and how do you have that conversation with your health systems? Well, now you can, right? And then from that point, who are the partners that are actually receiving those referrals? So we start seeing our different home health and home care providers and anybody associated with community-based resources, for example. They'll land here, and we'll see that clear snapshot of our outbound referrals broken down by partner. So if we need to focus and segment our conversations because we know we send 85% of our referral volume to 3 partners, let's really dig in and ensure that we have quality and outcome agreements associated with those partners. And then once those agreements are set, we want to be able to review how engaged our partners are. So the first one here, time to referral first touch. Let's make sure that if I send you a referral, you're responsive. You're acting on that referral. You are messaging back, and we are making sure to transition this patient as quickly, smoothly, and effectively as possible. The other half of that equation is, when does that referral close? So it's the start of the conversation, it's the close of the conversation associated with that referral. And we want to highlight exactly what that looks like across your partner mix. Moving over, we see a few more examples, just kind of looking at that segmentation of how many patients are coming onto bundles with our organization, being able to report that back to our upstream providers, to those referral sources, those hospitals and health systems. And then lastly, looking at our declined referrals by reason. So as we're sending all these referrals out, we're doing the work, right? We're pushing these referrals out, we're getting them to our providers. And if they're being refused for a reason like other, this is a conversation that we need to have. I want to know exactly why these referrals are being declined. I want to understand what can we do better, how can we become more efficient. So this is a dashboard that is built specifically to your data, delivered at the cadence that we establish with you to ensure that you're operationally capable to improve your visibility into your downstream partner network, but also your management of the downstream partner network, giving you a scorecard to then walk back to your health systems and your hospitals and say, this is why you should work with me, this is why we should increase our business. So from that point, I'm going to hand it back to Iqbal to kind of close us out here.
Great, thanks, Travis. Hopefully that gives everyone a good overview of the enTouch system and how easy it is not only to join the network, but then also sign up and invite your partners. So I quickly want to walk through the steps to join. So either you're going to be invited by a partner organization and you'll follow those steps, but if you're getting started out fresh, you'll want to go to enTouchNetwork.com to sign up. And after you sign up, it requires a name, organization, and email address. You'll get an invitation once you've been verified as a post-acute provider. You'll get an invitation email from enTouch admin that will walk you through the steps of getting invited. And once you're on the network, there's a couple of steps you'll be walked through. One is establishing your profile on the network so that other partners know all the different services that you offer, the insurance carriers, et cetera. And then you'll want to go ahead and invite your partners to really build out your network. So downstream partners that you're making referrals to, and then potentially upstream partners as well that you're receiving referrals from, to really kind of start to grow your referral network and your partner network. If you have any questions about any of the process about getting signed on, you can always email us at info@entouchnetwork.com. So that concludes our webinar today, and we do have a few questions that I want to walk through. The first one is, am I able to invite my preferred home health partners to join with me through enTouch? And the answer is yes. That's one of the largest use cases for skilled nursing facilities, to be able to coordinate those referrals and patient transitions from skilled nursing to home health. And as Travis had walked through that process, it's easy to either find home health partners who are on the network or to add your own and send them invitations with personalized notes. Another question that's come in is cost to join the network. So actually, we've made the network free to join. So you can log in, you can sign up and establish your profile. We only start to charge after you've received 10 referrals. So if you're a skilled nursing facility and you're using this for patient coordination and sending out referrals, there's really no cost to join the network or to be on the network. If you're starting to receive referrals, that's when we get into a paid subscription model. And we found that our partners really are enjoying the data that they're receiving from the network and find it to be well worth their time and effort to get on the network, especially as they start to increase their referral flow from other partners. I think that's the last question. So I want to thank everyone. This webinar was recorded, and we will be sending out a recorded link. But I also want to encourage everyone to go to enTouchNetwork.com and go ahead and sign up to get your organization on the network, and hopefully you'll be seeing better patient care and coordination as a result of enTouch. Thank you very much.
Thanks, everybody.